and the whereabouts of Martin Pebu, a big question. But we have answers. And in fact, what we are learning currently is that he's being held in an NIB, office. But just like you see on your screens, this is the office of the Special Prosecutor's building. And you can see lights on. Fatal Bayaga is live. But we cannot confirm to you if Martin Pebu is still in this building. But what we can confirm is that their sources were telling us that Martin Pebu could be at the NIB building, still under investigation, just like Kweku Asante brought it to us, that Martin Pebu is currently under investigation or has been arrested by the OSP and is being asked, to meet a certain bail condition, which is lawyers are still trying to meet that bail condition. But information coming in is that we know that he's currently being kept at NIB. But that is the office of the Special Prosecutor where we were expecting him to be even around this time. But we confirm to you that in that building, his lawyers claim that Martin Pebu was not found in the building. But we'll continue with PM Express, and tonight we have a very special, interview with the boss of HeFRA. And whilst we still keep an eye on the Martin Pebu issue, that is going to be our main focus for PM Express tonight. And PM Express, as you always know, is brought to you by Pepsodent Cavity Fighter, Academic Times, and Syntestank, a strong, a tough. And just like I told you, we'll have a conversation with the boss of HeFRA, but we'll still keep an eye on the Martin Pebu situation because it's still a breaking story, it's still a happening story, and we need to keep tabs on that. And Dr. Winfred Kulete-Ban is my guest tonight. He's going to join me. We're going to talk about health facilities, very, very important in the country. We've seen a number of news around the clamping down of certain health facilities, and he's here to break it down for us, and he joins me in the studio. Welcome to PM Express.
Thank you. Thank you very much.
You just heard the news around lawyer Martin Pebu. I know you don't want to actually comment on that, but you heard that. That's the breaking story. Do you have any reaction as far as that issue is concerned?
Well, I don't have a lot of information around that, so I think I would prefer to keep quiet on that for now until I get information.
But let's talk about HeFRA.
Yes.
We know that HeFRA is very important in terms of our health service delivery. But usually the mistake is that we all see HeFRA to be the policeman that goes after health facilities. What more do we know about HeFRA? Tonight, tell us what HeFRA is and then what you do.
I think, like you said, the Health Facilities Regulatory Agency is an agency under the Ministry of Health. It's been set up by law to ensure that every health facility, and when we say health facility, we are not talking about just hospitals. Anywhere where health provision is carried out. So it can be in the lab, a diagnostic center, it can be in the care home, it can be in the pharmacy, anywhere. We must ensure that they meet certain minimum standards that are needed to provide safe and quality care to everyone living in Ghana. And that's what we do. We do this by making sure that before you open up a health facility, you need to come to us, you have to register with us, and then you have to provide certain documents and certain requirements. Once you meet them, we will schedule you for an inspection. Inspection means that we'll come to your facility. We will come and see what you have. We want to look at the facility, even the building itself. Is it safe for people to receive care there? Then we want to look at your processes. Do you have all the protocols needed? Do you have the manpower? So the personnel. So you need to have qualified personnel who will provide the care and the equipment. And so once we are satisfied, then we give you a license. And after that, we monitor you. So giving licenses for facilities to operate is one of the functions. But we go through a whole lot of process before you get a license. After that, we do what we call monitoring. So once you get the license, we don't just leave you there. We have to make sure that you are providing the care. It's a continuity. So sometimes we do unannounced visits. Come and see what is going on in your facility. Then another aspect of our work is what we call accreditation. Accreditation now looks at, so licensing looks at the minimum standards that you need to operate. And when you get to accreditation, now we are looking at quality improvement. So we want to see to what extent are you able to provide this service in terms of quality care. And that is when you tend to give facilities or services star grades, where you do 1 star, 2 star, 3 star, 4 star. But that aspect will develop in most next year, from next year.
But as it stands now, do you have any form of system that will help with this grading of health facilities, even though you're looking at advancing it next year?
Yeah, so currently we don't have any system that grades health facilities. But we have a structure. So for hospitals or health hospitals, we have different levels. It starts from the basic, which is the CHIPS compound. Then from there, you go to the health center, you go to the clinic, polyclinic. We have primary hospital, secondary hospital, tertiary, and then quaternary. So that's the only grading we have now. But from next year, we are going to start with a star rating system. And that has to do with quality services.
You have a certain particular tagline that I think that you need to explain more. Okay. And it's fascinating. I mean, reading this tagline, it says that no license, no operation. Sure. What is this, tagline?
So that's what the law says, that you cannot operate a health facility in Ghana without a license. It is unlawful, it is illegal to operate any health facility in Ghana without a license.
I know you are still monitoring, but do you have an idea of the number of health facilities currently in the country that are operating maybe without license? I mean, that in itself informs you day in and day out when you're going out to do some of this inspection. Although you have in your system the number of health facilities that have been registered, but you may also have an idea of those who are not registered.
Yes, so that's a very good question, and it's difficult to know the number of facilities that are not registered because they are not on your radar. And so, until we go out and we find them out, it's difficult. But in fact, with the recent exercise we did, most of the facilities that were closed down, about 70% of them were not registered with us. So it means that it is possible that as many as those who are registered, we have that number that is also not registered. But I want them to know from next year, we'll go after all of them.
Let's say you go after all of them, but I mean, I'm interested in terms of the registration.
Yes.
What's the attrition rate? I mean, in terms of the registration, how frequently do people come out to register? And even looking at the various health facilities, which areas do you usually find it easy, I mean, to get people to do the registration? Which areas is it so difficult for this health facility, administrators to actually register some of these health facilities that we're talking about?
Yes, so usually the requirements are about the same. I mean, the general things. It becomes, you have more requirements if you want to go higher. Maybe you want to be a tertiary hospital. And so when it comes to that, we have not noticed any difficulty for all the levels. Actually, before somebody decides to start a hospital, they are sure of what they need. And so anybody who starts the registration process, most of them, actually, about 80% of them complete the process.
In fact, that could be hospitals, but let's go to other health facilities.
Yes.
Like the eye clinics, the speech therapy centers, most of these places that we call centers,
yes.
right?
Yes.
I think that they are your biggest headache. I mean, what more do we know about the condition of these various health facilities and their registration rates?
So, yes, I think you are right. Definitely bigger hospitals, you will be noticed easily. But for the small, there are people who just get one room and they will be doing their own thing. Maybe it's just an ENT or an eye, and they will be doing. So I think for what we've seen, most of them are the smaller facilities, like you said. Most of those who are not registered, and then the OTC, the over-the-counter medication sellers, most of them were in that category. So maybe you are right, the lower the facility, the higher the default rate.
But in terms, sometimes the difficulty has to do with, the requirements you have to go through. Sometimes people are not even aware the location of HeFRA. And the difficulty is that, you may apply, it may take you a longer time before you even get your license and all of that. Don't you think that's, sometimes some of these excuses are the reasons why we see a number of our health facilities not registered?
You are right. I think for a number of them, that's their excuse. But I want to say that, the first one is about the requirements. That is a necessity. I always tell people, if you see a nice aircraft and you want to board, and they tell you this one, it is not being passed by the aviation authority, will you get on it?
Absolutely not.
You will not. Because you know that because the regulatory authority hasn't said it is safe, it may be safe, but you will not get on it. And before they pass that thing, they have to go to very rigorous checks just because of your safety. And that is what we do. You need to provide all the documents. And that one, we cannot do anything about it because it's about your life. And if you go and they inject the wrong thing or the wrong person injects you the wrong thing, you lose your life. You cannot bring it back. So we are protecting the public. We want to make sure. So as for our requirements, there are no shortcuts. You need to provide all of them. Now, when it comes to the licenses, I agree that it delays. But I can tell you, as we sit now, we've cleared our license up to October. In fact, just today, we've signed the October ones. And I have assured people from next year that once you apply, it shouldn't take you more than 1 month to get your license. And that is where we are taking it to now.
But that's your future aspiration. Yeah. But currently, what is the status? If I want to register a health facility, on average, how long will it take me to get all my documents together and all my license to be able to actually start operating?
So I think the delay comes from the facilities getting their documents together. Before you come you have to get a fire certificate, which means that fire service has to come and assess your place, make sure that you are fire ready, install all the things for you, and they give you a certificate. Environmental Protection Agency also has to come and inspect your place and give you a certificate. So I think these are the things that delays them. But once you get everything, you upload them on our system. We check it. Once they are fine, we schedule an inspection. And once the inspection is done and everything is fine, within 2-3 weeks, we should be able to get you a license.
But since HeFRA has been able to identify that these are the areas that certainly would delay the registration process, are you finding ways and means to do maybe partnership with the fire service, EPA, to help your customers who would want to do the registration, or you want to leave them to go and deal with fire service and EPA by themselves? Because, sometimes it gets difficult getting some of this, certification difficult for them to even upload it. And because of that, people just decide to go ahead. Once they have the equipment, once they have the space and the facility, they just decide to go ahead and do the operation.
Yes. But yes, I agree. We've had some engagements with fire service and the EPA. And so hopefully it should be shorter. We are in talks with them that for the health facilities, they should do some expedited action for us. So we are following up on that conversation. But I will still not take that as an excuse for somebody to start just because fire safety. What about if you start and there's somebody gets to your place and there's a fire outbreak? You don't have a fire extinguisher. What will happen to the patients? Maybe other people can run, but there's a patient who's probably had a fracture, cannot run. Will be bent.
The misconception is that sometimes some of these, health facility owners believe that they can start operating, get all of these requirements before they invite HeFRA to come and do the assessment or to come in and license them. Is it the case that without HeFRA, you cannot operate, or you can go ahead to do the operation, and then as and when you get all the details, you invite HeFRA to come and do the inspection?
It's like saying, my aircraft is ready, but the regulators are slow, So let's fly. When we come back and they are ready, we will check it. I don't think you want to get on that. So the law itself says that it is illegal. And when you are caught, we send you to court, you'll be jailed. So I want to advise everyone, health facility owners, you cannot start before you invite us. And in this era, if you start before inviting us, once we come to you, we will give you a fine. You pay before we give you a license.
Does Zipline come under your control?
No.
Why?
Well, Zipline hadn't been, they are not a health facility. They are providing some form of services, but they are not themselves a health facility. So it doesn't fall under us.
But you agree with me that Zipline is providing an essential service to the health facilities. So why is it not coming under HeFRA?
So they are under the control of the Ministry of Health. So the ministry controls them directly.
Now, my next question is where you draw your source of funding from. How is HeFRA funded? How do you even get money to operate? All
right, thank you. So HeFRA, we have two sources of funding. We have the IGF, the internally generated funds, and that comes from the registration and then the other fees that the facilities pay. Then we also have government of Ghana through the Ministry of Health giving us some subvention, so they pay our staff. And then we also get something from the government to run the agency. So those are the, and then sometimes we also get some of the donor agencies supporting some of our programs, like let's say developing the tools we use for the inspection, and then some of our other programs. Sometimes we get some help from other donor agencies.
When you speak about donors, right, and sometimes most of the health facilities regulatory agencies, you are based on what the donors are bringing, although you are also mindful, or although you are also keeping tabs on the fact that you can get some amount of money from your IGF. Let's split this into your source of funding into, let's disaggregate it. What percentage comes from donors and what percentage comes from your IGF, government of Ghana sponsored, and even looking at the vulnerabilities in a year where you are not getting a lot from donors, how are you able to, operate?
All right, so we get about 40% from government, we get about 40% from IGF, and maybe donors were just about 20%. But we don't even rely, that is not constant, and so we don't really rely much on that. Yeah, we don't really. But sometimes it doesn't come just as money, maybe vehicle, maybe computers and things. Those are the kind of supports we get.
What's the outlook of your budget credibility? Are you able to get all your releases under what has been allocated to you?
Well, yes, so when it comes to compensation, which is payment of our staff, that is done to controller, so we don't have any problems. The GOG that comes, yes, the government pays it, and we get our IGF, so we are able to manage with that.
In your own estimation, how much do you think HeFRA needs to actually operate in next year, 2026?
Yes, so next year we have big plans. We want to...
Talk to me about your big plans.
Yes. Yeah. So as we sit now, we are present in 9 regions out of the 16. And that's why a lot of facilities go unnoticed.
Especially in the northern part of the country.
Yes, in the northern part of the country, we had only 1 office, which is in Tamale. But just this year, when we took over, we've added 2 new offices that are just about being operational.
Also in the northern region,
so Upper West and then Upper East. So we are just setting up in Upper West and then in Upper East. Hitherto, it was just 1 office in northern region, overseeing all the northern regions, and that definitely brings challenges because you cannot go everywhere. And that means that your regulatory oversight over the facilities will be very, very low. And that will mean that some people may not be getting safe and quality care. So next year, we want to at least increase our presence in the rest of the regions. Now, our regional offices, out of the 9, only 4 of them have vehicles. The rest do not have vehicles. So we are planning to get some vehicles.
So you have 9 offices.
Yes.
And just 4 of them have
of the
vehicles.
regions have vehicles. That's just 1 vehicle each. So how do you go? So anytime we want to go out, we have to talk to Ghana Health Service, Pharmacy Council, or some of the other agencies who will give us their cars, or the ministry sometimes gives us cars, so we can go to monitoring. And you know, if you are in the northern part of the country, you can drive like 3 hours before you get to another facility, you know, and the roads are not too good. So we need support with vehicles. But I tell people, with what we have now, we are still doing our best, and we hope to do more.
I mean, there are currently over 80,000 health facilities across the length and breadth of the country. How are you able to keep proper surveillance with just 4 vehicles?
Yes, so that's what I said, that it's inadequate.
But I'm interested. I want to know how you're able to do that, because this sounds like magic.
I think, yeah, so what we were doing before us, so it means you go to one region at a time. So when you are going to one region, you marshal all the vehicles. So let's say you are going to Ashanti region, you can decide to spend 2 weeks, 3 weeks there, marshal all the vehicles, and then there are a few at the head office. We add them to it, and then we go. But like I'm saying, sometimes when we write to the ministry, they give us vehicles. Ghana Health Service also helps us with vehicles, and then we go. We are hoping to get our own vehicles.
I know your biggest headache has to do with the private health facilities. How are they coming on the wavelength?
Well, I want to say that since we took over this year, they've been very cooperative. We've had meetings with them. I've been at their conferences. And they are very cooperative. They are willing to cooperate, and then we've been working very well. So now a lot of them are coming on board. And I think that is a good collaboration. We are working well.
I want us to focus on what has been happening this year, because you've done a number of crackdowns, right? And I'm just observing my data here. 23 health facilities have been shut down across Ghana for operating without valid licenses or failing to meet required safety and operational standards. 23. Has this number increased?
Has increased. So currently, we've shut down 96 health facilities.
For reasons?
So most of them are operating without a license. And so about 80% without a license, 20% of them with expired license. So when your license expires, that you are also on the wrong side of the law. So these are the reasons.
Let me go with a number. How many are there?
About 80%. So we have 96 so far.
96.
In Greater Accra, Ashanti, Eastern, Bono, yes, Bono, and then Ahafo.
Which region is having the highest in terms of the shutdown hospitals?
Ashanti region.
Ashanti region.
Yes.
And most of this, I believe, are HeFRA facilities. Or
no, HeFRA facilities are not under
HeFRA.
us. They are under Traditional Medicine Practice Council.
Okay.
Yes. So they are not under.
That's another big headache taken away from me, because I know that is the main headache. But it is interesting that 96 health facilities currently shut down by HeFRA.
Yes.
And you are giving me the regional breakdown that the Ashanti region has
the highest 32. Yes.
Followed by
Greater Accra with 25. And then I think the rest share there. Of course, traditionally too, Greater Accra and Ashanti region has the highest number of health facilities. So it stands to reason.
But I understand if you go to the, I'm surprised that you are not having a significant number of that coming from the northern region. Because this year, for instance, you've been, although you don't have a lot of vehicles in the northern region and you have just one office in Tamale, you've been very heavy in the northern region.
Yes. So, in fact, I must say we've not even done a coordinated program in the northern region yet. It will start next year. But these are targeted actions based on our monitoring reports and other intelligence. So this year, we've been, Tamale Technical University Hospital has been shut down because of a lot of infractions. And I can tell you, we just asked them to reopen last Saturday.
Yeah.
And if you see the difference, the place is looking much better. The staff are happy. The patients that are working are happy because the place has changed. And that is the impact of regulation. I'm sure the next time we'll show you the videos before and after.
But even before the videos come, I mean, I need you to describe the picture you saw, because that was a big issue.
It was a big
when that hospital was actually closed down.
And
what was the picture before?
Interestingly, so that's what I said. It was a patient who first alerted us, and that was a good one. So, and we need that collaboration. Please, if you go to any health facility and you are not happy, just send us a message. We also have a WhatsApp line. Just send us videos. We will go after them. So it was a patient who first sent us the video. It was bad. I mean, there were a lot of things happening there. And so we did an undercover. We sent somebody to go there as a patient just to corroborate what the person said. And it was true. So once we have our evidence, we met the management and we said, this is what we've seen from our monitoring and investigations. They saw it themselves and they know it was true. So we said, patients are not safe in this. We need to close you down. And we told them what to do. I must say that the management of the Tamale Technical University and the hospital have been very cooperative. They did everything we asked them to do. And the place is looking much better. And for me, I really applaud them for that. So that is it. And we were able to do that. Now they themselves are happy. I can tell you when we closed it, a lot of calls came that said, oh, you people have done well. They say, every day we have been going there and we know things are not good. But who will come to our aid? But that is it. So sometimes we get intelligence from patients. And sometimes we also do our monitoring. Sometimes we do undercover. How
difficult is it regulating hospitals with big and heavy muscles like Korle Bu and Komfo Anokye Teaching Hospital?
Well, I must say that it's not been difficult. We are not selective. And if we find any infractions, we deal with anybody, no matter your name. No name scares us. The new HeFRA is all out to make sure that we protect the Ghanaian public from harmful practices. We want to make sure that every facility you go, you receive safe and quality care. So, Korle Bu, we inspected them, we went with the media. They followed us, they saw it. If there was something that was untoward, we would have dealt with it.
In fact, there's this news publication that came in July 24, 2025, when you visited Korle Bu.
Yes.
And this is what your external assessor, Dr. Kweku Senenya, had to say. Yeah. He said, your color coding, and he was telling the facility managers, your color coding and your bins, open bins and waste, infections waste and non-infectious waste, all mixed together. I think it's not good. Improvise for Korle Bu, not accepted. Trauma area, please, it's not good. We know you are overwhelmed by cases, but please, you know patients' privacy is critical. So even though we have a crowd, please try and ensure patients' privacy. I mean, you had a similar case with Tamale Teaching Hospital, and you closed it down until they did the right thing. Why in the case of Korle Bu, I mean, you are trying to be a bit diplomatic?
No, so you see, there are different levels of the infraction. This was bins and the color coding. So what we do is that we give you time to do it. So we gave them, and they've done it. So when we give you, we go and follow up. If you don't do it, that's when we don't just get up and close down.
Did you do same for the Tamale?
Yes.
I mean,
yes. When we, you see, when you look at the inspection reports from year to year, they've been touching on the same thing. Do this. Anytime we come for inspection, we give you our findings and recommendations, and it's been consistent over the years. So they've been giving prior notice and warning, but it got to a point that it was bad. And so we had to do what we did. But I'm sure everybody is happy now.
Let's look at this scenario.
Yeah.
Korle Bu, and your external assessor actually made mention that we know you are overwhelmed with cases.
Yes.
So if such a facility which plays an important and critical role in healthcare delivery finds itself in a situation where you've given it a lifeline and they've not been able to use that lifeline, and you are expected to shut down a place like Korle Bu, looking at the number of people who may be affected, How do you actually, sort out this equation to come to the conclusion that this is a time for us to do a shutdown, this is a time for us to give you more time to actually improve?
Okay. So when it comes to a place like Kolebu is like multiple clinics in one. So you cannot shut down the whole place because let's say cardiothoracic unit is
and in fact, we also have to know that each of the units is very, very important and critical.
Yes. So if we go to a place, see, Kolebu is different clinics in one, on one soil. So if we go to a place and that place is not doing it, yes, you can say no. Can we shut down this place? You can't shut down the whole of Kolebu because not all of Kolebu will be doing the wrong thing. Do you get it? Yeah. So if we find any section that is not doing well, we will. I can tell you. Has
HeFRA gone on record to have shut any unit in Kolebu down before?
Well, I think back then they threatened. It hasn't been done. But you can be sure that during my era, if we find anything, we will do it.
But let's look at
it. Is for, you see, you were saying, okay, because if you shut down, what happens? I remember when we shut down Tamale, somebody wrote that a lot of patients go there and it's one of the biggest facilities there. So what would the others do? Nobody really died from that. Actually, now they are in a better position to even serve the public very well. And before we do that, we actually gave them time to refer the patients to other facilities before we did that. And so we ensure the safety of patients.
Let's look at the licenses that you actually, issue out to these health facilities. And I remember you said that about 20% of the facilities you've shut down this year was not because, they did not have license, but they had their license expired. So if I get a license from HeFRA, how long does it last, and at what point do I renew it? Does it vary with respect to the type of health facility? What do we know about that kind of situation in terms of the type of license issued and how long it actually lasts?
Yeah, so we have two types of licenses. We have a provisional license and then a long-term license. So for example, if you are now starting and you apply, we come and inspect. Most of the time, you may not have everything. Don't forget, I said you have to meet the minimum. Yes. So we give you a provisional license. A provisional license is for 6 months. And during that time, there will be some recommendations. Once you are able to do them, we come and inspect and everything is in place. Then we give you a long-term license. The long-term license lasts for 3 years. So you have to renew it in 3 years.
But 3 years, I'm really interested to know why 3 years was chosen, because in the scheme of long-term, short-term, 3 years should be about short-term.
Well, 3 years is long-term.
Okay, for health, right?
For health, because a lot can change in a facility. And even that 3 years, it doesn't mean that we'll leave you like that. Every year we come for monitoring. We want to make sure things are going well. So the fact that you have a 3-year license doesn't mean that we've just left you to go. We will come there every year to inspect, and as and when necessary, or as and when an issue comes up. For example, if we are watching the TV and we heard that, hey, something has happened here, like the Tamale Central, we heard that the youth went there just because I think some bins were overflowing and a lot of things. And for us, so once that we heard that news, we have to rush there. And now we are also investigating them.
It means that the media is your ally.
If everybody, the media, the patients, and even the health, sometimes even the health workers, some of them in the hospital give us info
about the situation of the facility.
Yes. Sometimes some of them are there, but they are not happy with the way things are being run. I can tell you, there was a place we went to, and the nurse there was using the same catheter. When he finished, he will clean it and use it for another person. And somebody gave us a hint. So when it happens like that, we want to find out. We will send somebody there just to come. I'm revealing some of our secrets, but it's okay. So we do some of the, so sometimes some of the health workers also give us information. And the media also.
I really want to know, you've spoken a lot about so many things, but I want to know this year, for instance, what has been your biggest headache in terms of trying to actually go about your constitutional, provision? I mean, what has been your biggest headache in managing these health facilities and regulating them?
Yes, so health facilities are being run as businesses. So once you say you are closing down that's somebody's business, and their image is also there. So it's not been easy. Once you do that, you have to be prepared for calls from all quarters, begging, pleading, and all of that. But in fact, for some of them, when you explain to them, they understand that we have to do the right thing. It is for everybody. And I always tell them that anybody can be a patient at any time. You can be healthy. Maybe you are driving somewhere and another car comes to hit your car, sustain a cut. No matter how much money you have, they will send you to the nearest clinic to be stabilized. Before, if you can fly, they'll fly. And if that nearest clinic has a quack with infected needles, they will cause harm to you with all the money you have. So it is important that everybody supports HeFRA to do what we are doing. Because at the end of the day, it is for everybody's good.
I mean, it's interesting that you have a lot to do, but you are also constrained in so many ways. And you speak about the fact that, I mean, you have to regulate over 8,000, health facilities. The fact that you have just about 4 vehicles, right? But I'm sure that's just vehicles. In terms of other, materials and equipment that you need to be able to do your work, do you have everything, or it's just about transport that you have challenges with?
So most of our work is traveling, so transport is important. And I think that's the main challenge. The other one is most of our regional offices are even rented offices, private offices. A few of them, we have some government agencies giving us offices. So some we are renting. And even our head office, we don't even have space now. So one of the things we want to do next year is to get a land. We want to start our head office building. That's one of the projects we are looking up to. And I'm sure that people who are listening to us will come to our aid and help us so we can help everyone. But I can tell you, none of those things will stop us from doing what we have to do. We are going to work and work very hard for Ghanaians.
I mean, it's interesting that you said you're going to work and work hard for Ghanaians, but you have so many constraints, and you just say that you're going to work hard. But even with that, you know that once you don't have what it takes for you to work hard, there will be that sort of gap and all of that. But Ghanaians are also expecting that you come to their aid, arrest some of these quacks and all of that. And in fact, I want to know the kind of relationship you have with the agency that is responsible for, regulating those who are in the herbal, space, because that is very important. Whilst you are watching those who are outside of that bracket, there's a lot also happening in the herbal space. What is the collaboration like in terms of partnership between you and that agency?
Yeah, so we've been working very closely recently. We are actually planning from next year, we'll be doing joint exercises. Because you see, there are some of the herbal facilities that are operating like orthodox, and they are hiding behind the name herbal clinic. So they are there doing labs, they are doing scan without a permit from HeFRA. I want them to know we are coming after them. It is unlawful to operate a lab, a scan, pharmacy without a HeFRA license. So if you want to do herbal, do your herbal, and make sure you are under your agency, you are in good standing with them. But if you are doing herbal and you are doing the orthodox things, it is illegal, and the law will catch up with you.
I'm sure you agree with me that the ordinary Ghanaian, if they are faced with any health challenge, the first place they look out for is the pharmacy.
Yes.
I know there's a pharmacy council, but do you have any form of oversight over pharmacies as well? Sure.
So pharmacies, over-the-counter medicine sellers are part of the facilities we regulate. We do that together with the pharmacy council. Yes. So when you go, you see a pharmacy council license, you see a HeFRA license as well.
And in terms of the crackdowns that you've done this year, the 96 health facilities that you've done, how many of them are actually pharmacies, if there's anything at all?
No, we've not gone to pharmacies. For now, and even the health facility, we have not even gone to every region. We've just started. And it's not going to be just a one-time thing. Now it's going to be continuous. It's going to be regular. It's going to be part of our routine activities. Yes.
I want you now to talk about your big vision for HeFRA. I mean, what's your big vision? Because you are faced with so much constraint, but it looks like you have a very big vision for HeFRA. I mean, how are you going to execute that? I mean, first of all, I want to know what your vision is for HeFRA. You've spoken about, building your own head office, establishing new facilities and centers around other, northern parts of the country. But what's that big vision that you have for HeFRA?
Yeah, so we want to make HeFRA the continental leader when it comes to health regulation in Africa. And to do that, we want to make sure that our processes are improved and made seamless. We want to bring efficiency into the system. And I also want to find innovative ways of bringing resources into there. So I'm setting up a lot of other units. We are going to have a research and grants unit where we are going to write for grants. There's a lot of money out there for regulation. And so we want to think outside the box. So I'm setting up a research and grants office. And we have a lot of data, but no research output. We are going to bring up research papers out that will inform national data and planning. And with that, I am sure we can also get some grants to do some of the things that we are doing. We are also talking to donor agencies to make sure that they also help us to do what we have to do. So there is a lot that we are doing, and I have a very motivated staff. My staff has been working very hard. They've been very supportive, and you can see they even some of them followed me to the studio. They are very motivated, and they are the reason why I'm succeeding.
But in fact, you say you have a very, motivated workforce. They support you and all of that. But in terms of the size of your workforce,
yes.
How many people are you working with in all 16 regions combined? I mean, national. What's your
yes,
workforce size?
Everybody we have 145 staff.
145.
That is small, but we are still doing our best. Since we took over this year, we've been able to bring on board about 21 people. It's all about financial clearance. So we are hoping that next year we'll get financial clearance and recruit some more people so we can establish some more regional offices.
How about registration rates this year? How has it fared compared to other years?
So this year, our registration rate has increased by 25%. And it's all because of the action. When they heard, a lot of people now run to us. We want to register with HeFRA. So we've gone up about 25% over last year.
If I want to do any form of registration or want to register a health facility, what is the cost involved? How much do I need in total, the estimation, for me to be able to get the certificates from the Ghana Fire Service and also from the EPA and other documentation that I need? In total, how much do I need to do that form of registration with HeFRA, and how is that even constraining people from coming to you?
So when it comes to HeFRA, our charges are not much. It depends on the level. The labs, some of them pay like 2,100 for registration, and then some pay 4,100. It's the bigger hospital. So usually we charge per unit area. So a bigger hospital like Kolebu will be paying about 28,000. But generally, most of the usual clinics pay about 4,100. Yes.
4,100 is that not expensive?
For the whole year, for registration.
But I'm sure they raise questions about the cost as well, or it's smooth for them.
I think most, but these are big businesses. Running a clinic is a big business. Of course, I know they have challenges, but 4,100, I don't think it's a big thing for the clinics.
I mean, let's talk about the agencies that you have been partnering this year, for instance. Which of them has been very, very helpful in terms of the delivery of your work on mandates?
So let me start with my minister, Honorable Kwaduna Minta Akando. He's been very fantastic, very supportive, and always with me and say, how is it going? In fact, he tells me, if you go to any facility, you have challenge, just come. I will go with you and we'll go and close it down. I mean, he is so dedicated to his work. He's one of the best health ministers we have. And he is really, really doing very well. Then we also have the Ghana Health Service. Professor Kaba and his team, they've been very helpful. Anytime we need vehicles, although we'll be shutting down their facilities, they still give us vehicles. And then all the other agencies like NHIS has been helping us, Pharmacy Council and the rest. So, in fact, we all work together.
I mean, finally on this issue, I mean, you speak about the fact that sometimes when you go and you close a facility, you get calls.
Yes.
But sometimes it's not just calls. How about court issues and other issues that may arise as a result of HeFRA taking a decision to close down a facility?
Well, so far we've not had one because before we do that, we check our list and we make sure we are on the side of the law. So far we've not had any.
So apart from the fact that you get calls, are there also, I mean, these calls, are they political interference in terms of getting certain facilities registered, even though they have not met the needed requirements?
That you won't get me to do. But I can tell you that the political people who call me, of course, we are all together and they know me, I know them. So when they call and I explain to them, they understand. In fact, one of them, my big bosses called about a facility. So this one that you've got, don't you think it will give us a bad? So then I started explaining. By the time I was there, I said, oh, in fact, go and close more. In fact, if you need support, let me know. I will give you reinforcement. You get it? So I think once you get people to understand that whatever we are doing is for our good, it's going to help you and myself. Every reasonable person will support you.
Let's look at 2026. How many health facilities are you hoping to register? What's your target and how are you going to do that?
So in 2026, we've projected a 30% increment over this year. That's our target. And we are not only interested in coming to close down facilities. No, that is not what we want to do. We want people to comply. And so we have, in fact, when I gave an amnesty, we wrote a letter that those who are not, they should come. It was after that we started the exercise. So 2026, January, I'm giving you amnesty. Please come. If you are not registered, come and register. And then we can all do business in peace. But I can tell you that the new HeFRA is there. We are not going to compromise on quality. And nobody will tell us to register a substandard facility. Because we will let them understand that it will not be for their good.
Final words from the new face of the new HeFRA.
So I want to say that this thing is for all of us. Let's all come together and help HeFRA. We want to make sure that the confidence of the public in our health system goes very high, to the extent that when you are walking into a facility that is registered by HeFRA, you can tell yourself that I am quite sure that the people who will take care of me here are professionals, they are up to their task, and the environment, the equipment, and the processes are good. I am quite sure that all things being equal, I shouldn't be harmed. And that is what we want to do. So we need everybody's help, patients, workers, facility owners, general.
And we are still keeping tabs on that big story that broke today, happening now, developing story, Martin Kpebu's whereabouts. We've been gathering information, trying to work our sources. We have information for you, and if Kwekwa is in the studio, you get exclusive. He's here with the latest information about the whereabouts of Martin Kpebu and what we know so far. Kweku, I mean, you have been working your sources, and you tell me that we have latest information as far as this issue is concerned. What more do we know in terms of what we know about the whereabouts of Martin Kpebu?
Kofi, our latest scoop we are getting is that Martin Pebu, right behind me, may not spend the night in NIB facilities because, as we know now, the place that Martin Pebu was being kept was NIB because the special prosecutor had actually caused his transfer to that place, and now we know that there are certain people and certain forces that have intervened to ensure that Martin Pebu is released this very evening so that he can go home. He went to the special prosecutor this afternoon, expecting that it was going to be one of those routine meetings that he had engaged in the last time the OSP invited him over the allegations he had made against Mr. Kisia Jabin, that bribery allegation that had caused the OSP to invite him to supposedly substantiate those allegations against the OSP. He went there the last time. It was a very brief meeting. And then the OSP again extended an invitation to him to appear today. And today when he did go there, he was very confident that he was going to leave pretty shortly. But that did not happen. He was detained. He was arrested on the pretext that he had allegedly obstructed an officer of the special prosecutor who was, investigating this matter or questioning or interrogating Martin Pebu, whatever the language you'd want to use for that. And so he was placed under a formal arrest, as we now know. And then the bail conditions was that he should produce a landed property in his name and then one surety. We understand his lawyers then left to try and get an understanding of, to see if they could be able to meet this bail condition. When they returned, Martin Pebu was not there. And in fact, at the time, they were telling us that they did not know about the whereabouts of Martin Pebu, that very famed and popular lawyer. He's also a media commentator and all of that. Up until now, we have now confirmed that the whereabouts of Martin Pebu is an NIB detention facility. Which of them we do not know. We know that NIB had a couple of them right here in Accra, and so we cannot confirm to you which exact location of the NIB facilities is currently the subject of the detention of Martin Pebu. But we know now that certain intervention is happening and that Martin Pebu is not expected to spend the night in OSP custody in NIB detention facilities, and ultimately he will be released. So many people speaking, condemning the special prosecutor for what they call an overreach, that those who are telling us that the special prosecutor has no set powers to do what he has done to Martin Pebu, and that this was a bribery allegation made against the special prosecutor. The special prosecutor's office did not have any power to proceed to purport to investigate its own self as it so were. And there are those who still said that Martin Pebu did not have to be arrested in the way that he has been. There are a lot of commentary that we are getting about this very matter coming on. There are those who say that they can no longer, in good faith and in good conscience, support that. Mauli Dak is a very popular lawyer on social media talking about this. He says, unfortunately, I can no longer, in good conscience, stand with the office of the special prosecutor and the special prosecutor. It is unconscionable, it is shameful, and unacceptable. A lot of comments coming in. Oliver Back of Omawo has also spoken about it. Kwame Sapon, a CRU, says this is a miscalculation. It's due process of bloody mindedness. This detention seems to have backfired. The longer Martin is kept, the more damage it does to the office. Never become the news unwittingly. And then Professor Stephen Kuku Asari saying that if there is no corrupting allegation against Martin Pebu, the alleged detention will be an abuse of the OSP's very limited power. So many people speaking about this. Martin Pebu, as we know now, in detention, was arrested by the Office of the Special Prosecutor on allegations that he had obstructed an office of the officer of the OSP who was doing his work by questioning Martin Pebu. The specific details we do not know. We are expecting that either this very evening or very early tomorrow, Thursday, the special prosecutor will cause a public release to explain the specifics of all that is happening. So, Kofi J, that is what we are learning as producers work the lines to try and get some reactions to what we have learned so far. The facts are that Martin Pebu did go in there, he was questioned, and now accused of obstruction of the OSP officers who were doing this investigation. He was placed under a formal arrest and asked to produce a bail condition of a landed property in his name and one surety so that he could secure his release. And as the lawyers worked on that and were out of the OSP's office, his location was changed from the OSP to an NIB.
But they had also say he was whisked away, right?
Exactly. And so those are some of the information that we are getting because, and as you just said, Fatai Bayaga spent much of this evening there. There was nothing happening at the OSP because the lawyers actually knew or had been told that Martin Kpebu was not in custody at the OSP and he had been moved. They had to take some time before they could confirm that he has actually been moved to an NIB detention facility. What exactly that facility is, we do not know, but we expect, as we know now, that Martin Kpebu may get his freedom this very evening.
In fact, even before he entered the premise today, we had that exclusive interview with Martin Kpebu where our reporter Fatai Bayaga actually spoke to him. He looked very, very, optimistic going to that sort of engagement with the OSP, saying that he was expecting that engagement was going to be with him and the high levels at the OSP, and he was not going to have it if it was going to be an engagement between him and the subordinate of the OSP. I want us to go back and listen to that interview. That was an exclusive interview that our reporter Fatai Bayaga had with Mr. Martin Kpebu today when he was about to enter the OSP building.
That they would get it right this time. Remember, I've been here twice, and they couldn't constitute an independent committee. They kept making me appear before subordinates to the special prosecutor. They kept making me appear before subordinates. Subordinates can't investigate their boss. It's incompetence. You see, that's the very thing they did, and then Ofuriatta left Ghana. And that's what they've done on 2 occasions. So today, if I get in there and the board or whoever, the committee is not properly constituted, I'm not coming back.
But are you willing to cooperate?
Oh, absolutely. That's not in doubt. It's not. We haven't even reached that threshold at all. Look, let's get it clear. What Mr. Kisia Jabin has been doing so far, the 2 appearances, is that I should give my information to his subordinates. You, Fatao, can you investigate your boss? Can you investigate your boss? Can you investigate Mr. Kwesichu? Why is that going to happen? And you think you can keep your job? It's ridiculous. So now I understand how he just botched this whole Ofuriatta matter, that he can't even get basic things right. Basic things. You're saying that give information to your subordinate. How is the subordinate going to investigate the boss?
Well, Kweku, I understand that the OSP himself has been in the news. There are a number of petitions against him. And just this, last month, we got a report also from the IMF government, or Goddess Governance, Anti-Corruption Governance, and the OSP featured heavily. But I want us to focus on the petitions we've received this month and last month with respect to the removal of the OSP, because we understand that Martin Kpebu himself also decided to file one to the presidency demanding the removal of the office of the special prosecutor, the SP himself, where Martin said that he believed that his petition was going to be the one that could get the OSP out, the SP out of that office, because he said he had evidence, he had substance, and he believed that his allegation against the SP had a lot of weight. What more do we know about the number of petitions currently before the president, that has been sent to the presidency as far as the removal of the SP is concerned?
So as we can confirm this week from the presidency, there were 3 petitions. In fact, 10 in total, 7 of them related to the Electoral Commission, 3 of them regarding Special Prosecutor Kisia Jabin. There are allegations of impropriety against him that is seeking to oust him from office. All of that has gone to the president. The president has a very tight rope on this matter, because the OSP, the act has very strict timelines that must be followed. The president immediately must submit that petition to the Chief Justice, who must determine whether there is a prima facie basis, a prima facie case to be made. And the Chief Justice himself must do that in 14 days. If he does so and he believes that there's a prima facie case against the special prosecutor, he put together a committee of 5 members, 3 of them Superior Court judges, and 2 of them ordinary members of society who are not lawyers, who are not members of parliament. That committee has 90 days maximum to bring a report on whether or not they are reporting the removal of the special prosecutor. So 3 petitions currently on the desk of Chief Justice Paul Bafubon. He has to decide on that, and all of these matters having to come. Martin Kpebu himself talking about the fact that he himself wanted to write a petition and send it to the president to cause the removal of Kisia Jabin as special prosecutor on a number of grounds, because he did not believe that Kisia Jabin was qualified for that office, and in particular, the way he was running affairs in that office. And that is why he was sending that petition. So Kofi, the special prosecutor himself, big in the news this week with a number of allegations against him of impropriety, among other things. And then this evening, another big news when his officers decided to arrest Martin Pebu. He's still being detained. We understand he may be released this evening. But as we speak, just about 10:30 on the dot, Martin Pebu is in the coolest, it's not in the comfort.
In fact, Martin left home very early today, still 10:30, he's not home. But, I mean, just like we told you, Fatal Bayaga is on ground, and you see behind Kweku Asante, that is the picture or the visual we are getting from the office of the Special Prosecutor building. You can see that up to now, there are still lights on, and fresh information we are getting is that Martin Pebu is now being moved from the NIB office to the office of the Special Prosecutor again. What will happen? We are still keeping tabs on that.
That is where normally, if the bail conditions have been met, that is where the bail will be executed. And so if it's being moved from NIB back to, and you see the lights there, this gives me some things about transfer deadline day where club offices, there are still lights in there and all of that. And so if the bail conditions have been met and have been satisfied and the OSP is convinced about that, they have to move him back to the specific agency that granted him that bill for the bail condition to be executed. And so once that is confirmed, then they bring him back there and execute the bail. Martin Pebu can then leave and go get some rest. And obviously tomorrow, Martin Pebu himself, if he regains his freedom, eventually he will be speaking and giving the facts and giving everything that happened behind closed doors, led to his arrest, and everything we've done so far. Well, expect the OSP himself to do something similar.
Well, Victor Kojoga Daudu is joining us on this particular issue. He's a legal practitioner. He's joining us on this particular issue. What was your first reaction when you actually heard this news? Would you say that this was expected, looking at the way everything around this Martin Pebu versus the OSP is concerned?
For me, when I heard it, it was unfortunate, and I felt that it was an abuse of power, abuse of position, and abuse of authority.
Do you think that the OSP has the legal right to detain Martin Pebu for this amount of time, and then also be taking him from one place to the other as far as the domain of this issue is concerned?
I have already stated it's an abuse of power in the sense that what is the offense of Martin Pebu? In the first place, you had invited Mr. Martin Pebu to come and substantiate an allegation he's made against you. He went further to make a petition, to draft a petition to the president for your removal. So that even the mere fact that you had gone ahead to invite him is that you want to be a charge in your own cause. You cannot investigate an allegation against yourself. And you have invited this man. He gave you respect that if there is an invitation, I would come. And the man says that I'm not going to speak to you. I may want to speak to your superiors. So that is his constitutional right he has exercised. And while the man is leaving the office, you come and policeman says that he is obstructing officials. And you charge him under the OSP Act, and you come and say that I don't have a hand in it, it is the policeman. On whose authority that the policemen are found on your premises or within the presence of your office? It is clear blood on his career. It is unfortunate. It is unfortunate.
So if now, please go ahead.
Well, he's been granted bail. There is conditions, factors that have to be taken into granting bail or refusing bail. You said you've charged a man. You put an onerous condition that he should be bailed. He's been bailed. You've asked for justification that he should bring a landed property document in his name. Once they bring the document, you vacate the place, abandon your duty, instruct your personnel to leave, and you say we have closed, so we will not be able to execute the bail. It's clear abuse, and it shows that there is some malice, there is mistrust, and you just want to use your power or the discretion that has been given to you to punish somebody. As the bail, it is stated that bail should not be used as source of punishment. For me, I think that this is one of the cases that citizens must arise and resist any oppressive rule. Any person with power, authority must be resisted, and the right thing must be done.
Okay.
So, for me, if Martin Kpebu is going back to the OSP for the bill to be executed, it tells you that there is always somebody always has a superior, and there's always a superior thing that the wrong must be right.
Okay.
So,
Okay.
for me, yes, that is it. It must be condemned in uncertain terms.
I'm grateful, Victor Kojoga Dawudu. Thank you very much. I understand. Honorable Francis Xavier Sosu, Member of Parliament for Medina, is also on the line. You heard this news. What was your initial reaction, and what do you make of what has happened so far?
In fact, what has happened so far is seriously embarrassing and very disappointing. It doesn't make sense. It doesn't make legal sense to me because, in the first place, I don't know how Martin is under investigation. If I have made an allegation against the OSP, how do I tend to be the one to be under investigation? And in the first place, how can the OSP even investigate himself? If there's an allegation against OSP, who is an anti-corruption agency, I'm expecting that institutions like IOCO or some other agency of state will take up that matter and want to investigate. So the invitation of Martin in the first place is not legally justifiable. There is no basis for even inviting him in the first place. Then secondly, to have even detained him is even worse. Because, what would be the basis? Honestly, this is completely unacceptable. It is illegal. And I think that, as I've heard many people condemn already, it must be condemned. This is so wrong, and it must not be accepted in a democratic society.
But was Martin Kpebu right demanding that he really wanted to be only, investigated or spoken to by the SP himself, or maybe a superior, body other than his subordinates?
If Martin is not the subject of your investigation, or even though, there are people who are subject of your investigation that you send your investigator to go and interview. Martin is not your typical public officer that you want to investigate anyway. So you couldn't send your investigator to say, Martin he has some information. Let's get in it. You could have done. So then, what needs it, firstly? And then the arrest, the most arrest, because I don't even understand how you would invite somebody, get the person, attached, for them in the process, you turn around to arrest the person. This is clear case lawful arrest and a clear case abuse of power.
Well, gentlemen, I'm grateful that you could join me. The whereabouts of Martin Kpebu. What we are learning currently is that he's being moved from the NIB office back to the office of the Special Prosecutor building, just opposite Parliament. And what was going to happen, we simply do not know. We are keeping tabs on this, breaking or developing story. Martin Kpebu, as we are gathering, is now being moved from the office of the NIB back to, the office of the Special Prosecutor. And fresh information that I'm getting is that Martin Kpebu, who has been under, the investigation of the office of the Special Prosecutor, went to NIB, back to office of the Special Prosecutor, has now been released after some interventions, just like Kweku Asante told you, that now Martin has been released. That is the fresh information we are getting. So the fresh information we are getting is that Martin Kpebu has now been released, and possibly he can now go home and sleep. He went to the office of the Special Prosecutor, the premise around, in the morning. Our reporter, Fatal Bayaga, spoke to him that morning. He's been there. It got to a point we didn't know his whereabouts. We got to know he was at NIB, brought back to the office of the Special Prosecutor. But what we are learning currently that he has been released. We are still keeping tabs on this issue, and as if anything else happens, as fresh information comes, we'll bring this to you. Stay with us here on Joy News. This is a happening story, And when we have fresh information, we'll be bringing that to you.
Remember.